Doctor, you study nutrition and its effects on overall health. Why do you think that, generally speaking, that's something that's probably still overlooked, or there's a disconnect with most people?
Well, certainly in the field of medicine, it's just not taught. So less than a quarter of medical schools currently have a single course in nutrition on average, and doctors may get 5 hours of nutrition training out of thousands of hours of preclinical instruction. I went to the school with the most nutrition training, 19 hours at Tufts, and it's still just a pittance compared. When you think about the top killers, the leading causes of disease, disability, and death, I mean, they're nearly all nutrition related, yet we don't hear about it. They're not tested on the board, so medical schools don't have a high pass rates for the boards. They don't teach it because they don't ask questions about it. And then when doctors get out, there's no postgraduate medical education, so there's no kind of continuing medical education. Doctors have to learn, get a certain number of hours every year. And we don't have any kind of mandate for doctors to get training before, during, after school. And even in the schools where they're actually teaching some nutrition, what are they teaching? I mean, it's often kind of the biochemistry of vitamins, that kind of thing, not clinical nutrition, not the role nutrition can play in preventing, treating, and reversing some of our most serious diseases.
Why is that the case in terms of education for doctors? And is that changing at all? I mean, doctors like yourself and many that we talk to say the same thing. Do we see it changing at the education level?
Well, unfortunately, so it has a lot to do with reimbursement. So what are doctors getting reimbursed for? And so you cannot get reimbursed for nutrition counseling, for example. So the insurers won't pay for it, Medicare and Medicaid won't pay for it. So if you're not paid for it, I mean, how as a doctor can you kind of make a living? And so there's a problem kind of at the back end as well, financial considerations. You also have to ask, who is funding medical education, right? So I mean, as medical students, we got taken out on so-called drug lunches, which is the pharmaceutical industry takes us out to, fancy dinner. Or Caribbean vacations, or I mean, all down the list. Never once got taken out by the broccoli lobby. Never once, and why? Because who has the money, right? So who has the money to pay for education? Who has the money to get this information to doctors' hands? And frankly, who has the money to get the information into the public hands, right? Do you see ads on TV for broccoli? No. Do we see ads on TV for pharmaceutical drugs, the latest kind of medical surgical treatment? That's because there's a financial incentive, there's a profit motive to get this information out there. But what about all the amazing science that currently exists about the role of natural remedies? If there's no money to be made, they just kind of get buried in the medical literature. They can be in some of the best medical journals on the planet, but they're just not covered because there's just no kind of promotion budget to get it out there. And so that's kind of how I see my role in taking that kind of mountain of good research, just translating it out to the public and getting it out there for public consumption.